So I'm a consultant psychiatrist, and I was on call about a month or so ago about a lady in her 80s who'd been seen at home by an on-call GP. The GP had been called out because there were concerns that she was refusing her anticoagulant injection, and she was receiving care at home with also daily input from a caring agent. The GP was also concerned because she was presenting with some psychotic symptoms. She was known to have a history of psychosis, but he was worried that the psychosis might be the reason why she was refusing her physical health treatment, and he'd suggested a mental health act assessment. Because the GP had been out very late at night, this had been left for me on the following day to deal with. I was able, on using the links within Rio, to access her GP summary records through the MIG, and that allowed me to look at her medication summary. And I recognised that she was on both an oral antipsychotic and a depot antipsychotic. So that made me begin to wonder whether her psychosis may be more of a chronic presentation, and therefore the benefit of an acute admission on a Sunday to hospital might be less clear. We also only had concern that she'd been refusing the anticoagulant for a day or so. Whilst looking all of this up and reviewing her mental health records on the system, I also noticed a link to the social services, her carer agency, and a phone number for that agency. I was able to phone them, and they were going out to see her twice a day, and I'd actually been out to see her that morning. And I had no immediate concerns about her welfare. They explained to me that her presentation was quite typical for her, that she did have these psychotic symptoms that were quite long-standing, and actually she would intermittently refuse her medication, particularly when her son was on holiday, which was in fact the case at that point in time. We discussed and agreed that actually it would be more beneficial for her to see her GP. In the past, her regular GP would pop out, encourage her to take her medication, and she would do that after seeing him. And so a plan was arranged whereby we didn't go forward to a mental health act assessment, but the following morning, on Monday, I rang up a local GP who was well aware of her case and was quite happy to pop out and see her. So we didn't require the arrangement of a mental health act assessment, which of course would have involved lots of unfamiliar people for her, individuals that didn't really have a lot of direct experience of her presentation over the past, and may well have led to a decision for an acute psychiatric admission to try and manage the risks. We're able to keep her in her own home with the support of her carers and a regular GP, all because of these links that we have through our electronic record system.